Hi guys, my name is Soraya and my channel is about skin, hair, health and wellness. Check out my previous videos. Today this video is going to discuss some few things. You've already seen in my thumbnail. I'm going to be talking about hypertension. Are you battling with hypertension? I bet you've heard stories about people like collapsing in the streets. Maybe you have yourself or a relative who is battling or who is struggling with hypertension. Hypertension usually runs in families, so it is something that you've heard about. It's something that you've discussed probably with your doctor, and I'm sure you've heard that hypertension is a silent killer. So what is this? What is this hypertension? What makes it a silent killer? A silent killer because it doesn't present with any symptoms. The definition, a loose definition of hypertension is a persistent elevation in your blood pressure, and blood pressure is determined by two values, usually written like a fraction. So you have the upper fraction, the upper part of the fraction, and then the lower part of the fraction. So the upper fraction is what we call systolic, and the lower fraction is called diastolic. And I'm not going to go into that right now, but those are the two numbers that you need to know. So those persistent elevation in that number is what we call high blood pressure. So what are the normal values? Your normal values, if you don't have high blood pressure, should be less than 120 and at the top part, and less than 80 for the bottom part. So if you're around 120/80 or less, you should be fine. And if it's too low, then that's another issue. We're not going to discuss that today. So yeah, that is a normal blood pressure. What happens when you're prehypertensive? Prehypertension is when that number up there is between 120 and 139, and the lower part is between 80 and 89. So if you're like 134/80, some 85 maybe, that is prehypertension. And then you have hypertension, which is divided into stage 1 and stage 2, and it might have changed, the categories might have changed, but this was I think the last one that I had checked. The stage 1 is between 140 and 159, and the lower part is between 90 and 99. So that is if you have a blood pressure of 150/90 something, that is you have high blood pressure stage 1. And this is you have these values consistently. Like you go today to your doctor's office, they tell you it's 150/something. You go another day, you maybe to the to your pharmacy or to your drugstore, and they do again, and it's the same, nearly the same value. You do this consistently and you're getting elevated values, then you're probably hypertensive. And then you have stage 2. So I said there are two stages. There's stage 1 and then there's stage 2 hypertension. Stage 2 is when that value on top is more than 160 and the value below is more than 100. That's when you have stage 2 hypertension. So normally you will not have symptoms. It just comes up on you. There's nothing much you can tell unless you're really actually checking your blood pressure, and that is why you have to go to your doctor. You have to go for your annual exams. Every time you go to the clinic, your doctor will tell you're gonna pass by someone who's gonna do your blood pressure, your height, your weight. These are the basic things that they need to know, so that they know if you're hypertensive, if you're overweight, as that determines the things that they may ask you in terms of your blood pressure. So yeah, it may not present with symptoms, especially in the early stages, but in the later stages you may have symptoms. So you might have headache, dizziness, fatigue, visual blurring, palpitations. Yeah, so those are the symptoms that you may have when you have high blood pressure, of which if you're fatigued, you might even dismiss them, or if you're stressed, you might dismiss these symptoms. You might say, oh, I am stressed, I have a headache, but you might actually be having high blood pressure, or even that the stress is causing you high blood pressure. It may be both. So you have to, I would say it is wise, if you especially if you have a family history of high blood pressure, to have a high blood pressure machine at home so that you can check your blood pressure. And I will discuss how to check your blood pressure as we talk about this. So those are the things that you need to know. You need to know your numbers in terms of what are they looking for when they say you have high blood pressure. And then of course, then if you have like a blood pressure of like 200 over maybe 120, that's like what they call a hypertension urgency or emergency. You have to go to the hospital, because those are very high blood pressures, and then can cause complications like strokes. And those are the things you see on the street when somebody, collapses. Maybe they have a high blood pressure which has caused one of the arteries to burst. So yeah, that is, you need to go to the hospital when you have very high blood pressures. The symptoms are, as I said, so what happens when you have high blood pressure? When you have high blood pressure, you have either too much like volume in your heart, what they call a cardiac output, which is causing too much fluid flowing in your arteries, which causes a lot of like pressure, just like I imagine it like a tire. If you like have too much air going in the tire, then you have too much pressure on the sides of your arteries. That's what is high blood pressure. And then if it's not the high volume, you have a very narrow artery. You can imagine a very narrow like tire, not being able to pass your normal fluid through your body. So if your arteries have become like narrowed, that there's some resistance there, so that's why it's causing the blood pressure. So some things that may cause you to have like a high volume, if your kidney is not working properly, it's not removing water as it should be. So if you have any kidney problems, it may cause you to have a lot of fluid in your heart. If you have heart problems, like you have what we call cardiomyopathy or cardiac diseases like valve disease or rheumatic heart disease, those are the things which may also cause you to have a high volume in your heart. And then if your arteries are resistant, usually the main problem is either aging, your arteries have become hard, and the other thing that may cause narrowing is things like smoking, diseases like high cholesterol and diabetes cause a coating inside the arteries, what they call plaque. Just like you have plaque on your teeth, which may be like it's a hard coating. You have that hard coating in your arteries, so which is caused from piling of cholesterol or fatty deposits, and sometimes the sugar. If you have sugar which is not being controlled well, the sugar also helps to make that cholesterol build up. And if you have like injuries in your arteries, like your arteries are not like lined well, what we call platelets may also cause that lining to be coated within your arteries, causing narrowing of your arteries. I don't want to complicate things, but if you have that narrowing, you may have high blood pressure. So what complications can you get when you have that high blood pressure? You can imagine the pressure going through your arteries. If your arteries are hard, then it's too much pressure. Your heart is working overtime to pump fluid to the rest of your body for it to get oxygen. So your heart gets tired, your muscle gets tired. It becomes fast. It may become what they call increased muscle. It may cause an increase in the muscle in your heart, and then your heart may not get enough oxygen, and what they call ischemia, myocardial ischemia, or MI. If you have heard of MI, that's myocardial ischemia. The muscles of the heart become deficient of oxygen, and then you get a heart attack. You may also have what we call an aneurysm, where the pressure within your artery causes the muscles in your artery to separate. Like I would say, for example, a hernia. When you have an umbilical hernia, where you see like it's popping out from your abdomen, that's the way your arteries, if you have like high blood pressure, the muscle starts to pop out instead of being just a narrow like tube. So you may have an aneurysm in all kinds of blood vessels. You may have some in your abdomen. If you've ever heard of an abdominal aortic aneurysm. You may have some in the brain, where you have a brain aneurysm, and if a brain aneurysm bursts, you may have a stroke, and that could cause you paralysis. It can cause renal failure. The arteries in the kidney may not be getting enough oxygen, and they may fail and cause other diseases, and that the renal failure can worsen your high blood pressure, because the renal system is very involved in setting your making sure that your pressure is within normal. And then there are other things which may also cause, apart from just the volume and all that stuff, there are other things. So this takes me to your risk factors. It's not known why people have high blood pressure, and 90% of it is what they call idiopathic. The cause is not known. And then there are secondary causes, like as I said, your kidneys. Other things that may cause that would be like your hormones. Things like what they call the adrenal gland produce things called stress hormones like cortisol. So that's why when you're stressed, either mentally or physically, it may present, or if you have anxiety, it may present as high blood pressure. I said the kidney, the hormones, liver. If you have like a liver problem or like liver cirrhosis because of maybe alcohol or drug related, that may also cause what they call portal hypertension, which also presents in its own way and may cause bleeding. Or you may have hypertension in the lungs called pulmonary hypertension, which may cause problems with your breathing. So that is like things with causes and things without cause. Like hypertension may have no cause, or it may have a cause. It can also be divided into things that you can change and things that you cannot change, what we call modifiable causes and non-modifiable causes. So things that you can change in your life would be your diet, exercise, reduce your alcohol intake, smoking, certain drugs, especially like heroin and cocaine, those kind of drugs. Diabetes, for diabetes you can change it in terms of in the beginning you can change it with exercise and diet and living a healthy lifestyle. And then there are those things which you can't change. For example, age. People above 65 years of age have been shown to be more hypertensive, and that just comes with age. Your arteries are getting old and they are not able to function properly. Other non-modifiable causes is your ethnicity, your race. African or African Americans are known to have high blood pressure, and it's not just like race and high blood pressure. Some things are also related to how you process certain medications and all of that stuff. I'll get into that later. Age, genetics, race, and kidney disease. Some people have kidney disease, which is non-modifiable. Like your kidney just produces hormones that cause you to have high blood pressure, and this is something that not many doctors investigate, but you may have either in the kidney or the adrenals. It's called pheochromocytoma, and you can check that out. You can Google it, pheochromocytoma. I'll probably put it in a text, and you can Google that. That can cause you high blood pressure, and can cause you very high blood pressure actually. So in terms of the things that you can modify, and you can check my other you can check my other YouTube videos, is your exercise, your food. Try and reduce your cholesterol intake, take more fiber, eat your spinach. There are foods which are better for you in terms of reducing or improving your renal function or your kidney function, or your liver function, or an anti-inflammatory diet, things like cabbage, broccoli, Brussels sprouts. These are things which are anti-inflammatory. Try reduce your red meat if you can. Reduce your salt intake, especially when you're eating out. Eating out has things which have a lot of salt. Canned food has a lot of salt, and preservatives, things with preservatives have a lot of salt. So try and, if you can make your own food, fresh food, and control your salt, that would be better than eating out and not knowing what is in the food, or eating canned vegetables which have a lot of salt. You can also exercise. Exercise helps in dilating your vessels, helping to reduce the blood flow. It also helps to it just activates like your hormones and stress level, reduces your stress levels, and also reduces high blood pressure in that way. Eating a healthy diet, as I said, like increasing your fiber, reducing your sugar levels, helps not only in making sure that your body functions in a good way, but also prevents things like diabetes. So I'll go back to the I'll go back to medications, especially in African American people. Things that you think how they treat high blood pressure is by giving you certain medications. I'm not going to go through all of them. I'll probably link one or two YouTube videos so that you can see what blood pressure medications you can take. But you need to go for your annual checkups. You need to know that your high blood pressure is high. You need to take your medications. That is, apart from living a healthy lifestyle, once your blood pressure is up, most likely it's going to remain up. You need to take your blood pressure medications so that it stays at a normal level. So that's why you need to check. So that's why you need your annual checkups. You need your screenings. If you have somebody who is screening for free in those medical camps, go and have your blood pressure checked and treated. In terms of medications, I'd like especially African Americans and Africans to be careful, because some blood pressure medications do not work for all African Americans or Africans, because generally most of the blood pressure medications were tested with the white population or Caucasian population who are participate in the research. So if you're interested in research and you want to be in one of the research trials for blood pressure medications, it would be good for Black people to be more involved so that they get the right blood pressure, like the right medications for them. But there's some blood pressure medications which are more sensitive to African American people and not, and there are some which have more side effects to African Americans than not. So if you think your blood pressure medication is not working for you, please go back to your doctor and let them know that make sure you write down your blood pressure, take your medicine as you should, and if you see it's not coming down, let your doctor know so that they can switch your blood pressure medications. You don't have to have that one blood pressure medication, and everybody is different. As I said, there's so many things that can cause your high blood pressure, so some of the things may be targeting different organs, and not the right organ is being targeted for the blood pressure medication that you're taking. The other thing is, as I said, genetics plays a role. That's why I said everybody is like an individual, so that genetics acts differently with different medications. For example, Indians and African Americans have different ways they break down medications. Uh, in pharmacy, you are taught about how drugs are broken down. There's a pathway called cytochrome P450, which is different in every different for different ethnicities. So that may cause you to have a different way where your medication is broken down, and you may have certain side effects which other people may not have. So if you have any side effects with these medications, for example, headaches, cough, swelling of the feet, please let your doctor know so that they can either change your medication or monitor your lab work, or switch you over to another medication. So that's my tip for this video, a very important tip. As I said, also you can check your blood pressure at home. So when you're at home and you have a blood pressure machine, usually if you're doing it at home, you're going to use a digital blood pressure machine. So if you're using a digital blood pressure machine, make sure that you have rested. Sit down somewhere and make sure that you have rested for at least 5 minutes. Relax, put your arm at around your heart level, and then put your digital machine, or if somebody is taking your blood pressure, they'll put it around your arm, or wherever they can get like a pulse, and then they'll take your blood pressure. So you take your blood pressure, relax, and then a reading will pop up which showing you the top number and the bottom number, and write this down. If you're starting a medication, I would say write this blood pressure write the blood pressure number at least twice or 3 times in a day. I think twice should be enough. And then at specific hours, like in the morning and at night, and then write them down at least for 1 or 2 weeks. If you see your blood pressure is going down, good. Follow up with your doctor, let them know yes, it's going down. If you think it's not going down, tell your doctor so that they know what's going on, and they can see if they need to increase your dose or they need to switch your medication. This is also another tip for people who have high blood pressure, especially in African or Black populations. There are people who will try and avoid blood pressure medications, and that may or may not work. For those people who are using other medications like natural herbs to reduce your blood pressure, I would say know your normal blood pressure, know what is normal, know which one is high. For example, if I have a blood pressure of 150/80, then I already know I have stage 1 hypertension, because the top part is 150. So that is without medication. If I take a natural herb, whatever it is, some people take bitter melon, some people take garlic, some people take, I don't know which other herbs, Chinese herbs, whichever. Make sure that you're checking your blood pressure anyway. Don't just have blind faith. Check your blood pressure and write it down, and see if it is actually going down. And sometimes it may affect other things, so you still have to do your blood work. When you go for blood work, the doctor is going to look at certain things. For example, they might look for your sodium, potassium levels, because these things may affect, the blood pressure medicine may affect those things, cholesterol, your renal function, and your liver function. So these herbs also can affect your liver function, your renal function, your cholesterol levels. They may even cause bleeding for some things, because some of them are like blood thinners. So you can't just use them blindly, and you have to be everything in moderation. Don't use too much of them, because they may cause toxicity also. So I would say if you're taking those natural herbs, be careful. If it's working for you, fine, but just be sure that you're checking your labs, you're checking your blood pressure, you're making sure that all of those things that I have said are within normal. If they're within normal, then you're fine. If it's still high, then you know your herbs or natural remedy is not working, and you have to go back to your blood pressure medication. So that's the one thing that I see, that people either rely too much on like natural herbs or just like on faith, like religion, either Christianity being prayed for, or it's whatever religion you are in, Hindu, Christian, Islam, whatever it is. And yes, that is good, but if you're not checking your blood pressure to make sure that it's high or low or whatever, then it may not be enough. That's all I'm saying. So it's not bad for you to make prayers and use your natural herbs if you want to, but just be careful with that, because that is how I see the population getting into complications, when you could have reduced your complications much earlier, and you can live a longer life for your family. It's sad when you hear one of your relatives has passed away because of a stroke, because of high blood pressure, because of a heart attack, and you know that it could be prevented. There's medication. We're in the 2024. There's medication for all of these things. Exercise, I know people work hard. If you're stressed, to try, it's hard, but sometimes, take time spend with family, try and relax. Make sure you're eating okay, and just take care of your overall health, take care of your relatives' health, give them advice, give them tips, make sure you're following up with them. Sometimes, as I said, modifiable causes, sometimes it's a socio-economic issue. They do not have the medication to buy, and that's why they're using the natural herbs. If you're able to bless them with buying for them the medication, then help them in that way. Again, the follow-up is not just for your blood pressure and checking your labs, it's also to prevent any complications, because if you're now going into renal failure, because people do that, then you might have to do dialysis. If you have like a cardiac problem, you might have to have a visit with a cardiologist. If you're having like eye problems because of the vessels bursting in your eye, you might have to see an eye doctor or have glasses and all of those things. So it's not just following up because of the blood pressure, it's also to follow up to make sure that you don't have any complications. So I hope this video is, hoping to make sure it's not too long, but I hope it has given you some tips of first identifying what high blood pressure is, what you may experience, what complications there are, what the risk factors are, and how you can prevent it. And if you have any questions, put them in the comments below. Write any questions you have in the comments. Give me your experiences, and maybe people have different experiences that they've gone through, things that have helped them or helped other people. Have you read about it? Do you know any new studies? Feel free to ask any questions down below, and I will see you on the next video. It's been great being with you guys. Thank you for watching. Bye.